Welcome back to Killer Fun, where we explore the intersection of crime and entertainment every other week. I'm Christy.
And I'm Jackie.
And today, I am talking about the nurse.
And I am talking about Cleo.
We had two options for this episode. And we did decide on the nurse.
We absolutely did.
I went back and checked my notes and made sure that we were supposed to be talking about the nurse on Netflix
absolutely
today.
were, but somewhere
there was a little disconnect.
Well, my brain
in
disconnected.
Your brain. Yeah, that's
and
fine.
Somehow I thought Cleo.
Which is also on Netflix.
Yes, it is.
And a little like Killing Eve.
A little.
Yeah.
Ish.
It was the thing that related to stuff. So, yeah.
Yeah, they said that, and I saw that, and then I was like, okay, maybe it'll become that.
But not yet, not in the first episode?
Maybe not so much yet.
Okay.
Yeah.
Well, so you watched Cleo.
I did.
But you did not watch The Nurse.
I did not, which is going to bring whole new meaning to our entire format.
That's right.
Where you Google things and then I guess kind of like, oh, yes, I knew that. Or like, no, I didn't know that.
Right.
Because I'm not going to know what you Googled. So, wow.
Okay, so the recap's going to be really important for you this time.
Extremely.
Oops. Well. So if you haven't watched The Nurse, you can still listen. You can be like Jackie.
Exactly.
That's right. You can both, talk at me about like, wait a minute, I don't understand things.
Right.
So I'll start off by saying, how far will someone go to be a member of the dream team? That is my, one sentence synopsis.
No, I like it. Mm-hmm. I like it.
So the cast.
Okay, yeah, let's talk about the cast because we had looked at this.
Right. We did look at it because we were trying to make sure that it fit our parameters, which I'll get to. But the cast is all Danish. So it's overdubbed in English very, very well.
Right.
So they're speaking Danish the whole time. So Fanny Louise Bernth is Pernilla Kursman, and she's the whistleblower. She's our main character in this. So all she's done is Danish TV and movies, but one of which is a period drama about during World War II, Denmark allowed men to enter nursing programs for the first time.
Oh.
Yeah. So she's played a nurse before.
Okay. Yeah.
So then we have Josephine Park as Christina Astrup Hansen, and she's the homicidal nurse. Again, all Danish entertainment, but there is a dramedy also on Netflix, also overdubbed, called Baby Fever. So where she's also in the medical profession. And then there's Dick Kesu, who is Kenny Herskoff, and he's the brother to the first victim that we see. And he's been a mainstay in Danish television since 1973.
Wow.
Yeah.
Long time.
Long time. So, recap. Single mom Pernilla has attended nursing school and made a move to the town where her daughter's father lives. So Pernilla is on friendly terms with her ex. He encouraged her to move there so that she could pursue this job and also have some help with her daughter, because nurses tend to work long shifts. Mm-hmm. And he would get to see his daughter more. Mm-hmm. So it's a friendly relationship. There's even a point where the daughter asks if Pernilla and her ex are going to get back together. And she says, well, no, but we don't work together as a couple, but we're friends. We work together as friends. So, and as parents to her. So it's very sweet. Pernilla's job's in Ward 3, which is the emergency department. She finds herself working closely with another single mother, a more seasoned and very well respected within the hospital nurse named Christina. So night shifts tend to start out quiet. Pernilla, being new, is asked to work them. And since she is at a place where her ex can watch their daughter, is able to work them. So these night shifts tend to start out pretty quiet with patients stable and resting. But things seem to have a way of becoming exciting, at least when Christina is working. Christina gives Pernilla instruction on her first CPR outside of a practice unit, and the women are then called the dream team by a doctor when the patient survives. Suspicious circumstances both before and after Pernilla arrives make us wary but curious about what Christina is up to.
Nice.
So I would say the first episode ends and you're not even completely sure. Like, you have a weird feeling about Christina, but she's competent. She's interesting. She's well liked. Like, you even see like her reading books to become more knowledgeable, and she's a real leader. But there's just a little something about her that's a little off. So it's based on a book by a Danish investigative journalist, Christian Korfiksen. Cooperation from victims' families and coworkers give us the buy-in that we need. Now, Danish is a very difficult language.
Oh, yes. All of a sudden, I have lots of instruction manuals running through my mind right now that have difficult names.
Yes.
If you catch my drift.
Yes, I do. So the book's name by Christian Korfiksen is The Nurse, the true story behind one of Scandinavia's most notorious criminal trials. To give you an idea of how difficult Danish is, the Danish name of the book, I'm going to spell the word and then I'm going to say it.
Oh, Lord, this is worse. I mean, is this worse than Swedish? That's two different languages, right?
Yeah,
but
they
they're
are
very
two different
similar. Aren't they similar? Well, they look similar on paper.
They look similar on paper.
I don't know
would
if they're
say.
actually similar.
I don't know. I didn't look up how similar Swedish and Danish are, but they are
two different languages.
They are two different languages.
Right.
They're geographically near one another, so I'm sure they have some commonalities.
Yeah, because they're Scandinavian.
Right.
Right?
Yes.
Okay.
So the name of the book, which in translation is The Nurse, in Danish is SYGEPLEJERSKEN.
I feel like that's something I might draw in Scrabble.
Yeah, exactly. If you over more than one turn.
Maybe so. Like, I'm looking at that going, how can I make it work into this? But Jay, that's like 10 points.
So it is. The pronunciation of the word that I just spelled is suppliesker.
Oh.
Yeah, that's what I said.
Okay.
Oh, okay.
Okay.
Yeah, I read that Danish is particularly hard because they tend to swallow a lot of consonants, and it's not intuitive which ones are going to be swallowed in any given word.
Okay.
So just reading the word on the paper doesn't really give you much of a clue of how it's pronounced.
I mean, that makes sense. I mean, because, Rose Nyland, my girl from the Golden Girls, has all her like Swedish words, like her Scandinavian words.
Yeah.
And it's so funny to watch people try to spell these out and some I seem to be actually real and some definitely not. I don't know. But like, it's just very funny. Like how in the world? And I feel like Betty White is just a genius for being able to learn a small amount of words, but use them in such a way that like you would never guess that she really wasn't. I mean, that seems like a first language for her.
Yeah.
It's pretty amazing because what you just did right there seems very hard.
Oh, yeah. That's why I had to look it up and listen to it a dozen times. But it was published in Denmark, this book, and it's talking about the not only the case itself, but raises concerns about how much trust we put in our caretakers and how that evidence plays out in criminal courts.
Oh, man.
Yeah.
I feel like, what is the book? Is it in English? Have they translated
there's a translation,
it?
yes.
Oh, that'd be great.
Yeah.
I might be really interested in that.
Yeah. It was filmed basically on location.
Oh, that's cool.
So it is cool. So the hospital is the Nykøbing Falster Hospital. Like, they basically named it after the area that they're in. Okay. Nykøbing is the area that they are in, and that is where they filmed it in
That's
Denmark.
Super cool.
I think it's really cool. It filmed shockingly fast. They started filming in December of 2022, wrapped in March 2023. This released at the end of April 2023.
Whoa.
They must have had a tight film. There must not have been a tremendous amount of editing that needed to go into this.
I mean,
because
there must have been not much on the cutting room floor. I can tell you that, because otherwise it takes about that time to figure out how much extra coverage you have, you know?
Right. So, or
interesting.
They just had people working around the clock. Who knows?
Or that, but I mean, dang.
Yep. And they used actual hospital facilities, not the Nykøbing Hospital, but other hospital to make it look realistic.
Yes, because that's hard to fake.
Right.
And unless you're literally in Hollywood.
Right.
Maybe a few other sound stages throughout the world, but like, that's hard.
Yeah. So, sources. I like to give you resources if you're a victim in a similar circumstance.
Yes, I'm very interested to see what you came up with for this.
Well, unfortunately, not any great solutions. We'll get there, though.
Like, call a lawyer?
I mean, basically, that's my advice, is like you basically have to call an attorney.
And it's interesting because when we were first looking at it, even though I didn't watch the episode, I remember thinking about times that I've been in the hospital as an advocate for a family member.
Okay.
And how much the ombudsman, like the hospital ombudsman, is your friend. Like, this is the person you've got to go to. It's not a position most people realize exists in most hospitals.
Like, you're saying this, and my husband spent more than a week in the hospital last year, and I have no idea who this person was.
Right. So your ombudsman is typically, now this exists everywhere in military hospitals for sure.
Okay.
But also most civilian hospitals have one.
Okay.
And it's the patient advocate.
Oh, okay.
Okay. The ombudsman. And so the patient advocate is somebody who deals with the complaints, the suspicions, the issues.
Okay.
And oftentimes that'll go straight to the top, and you'll have a hospital manager sitting at your door before you know it. Should you have actual concerns?
So, first, you should know that homicidal medical professionals are rare.
Super rare.
There is not a lot of data on this, so I can't tell you actually how rare, but the fact that it's not studied more shows us that they're relatively rare.
Yeah.
But what can you or a loved one do if you've potentially fallen victim? First thing we need to do is understand what constitutes a medical malpractice claim. This is for the United States primarily.
Right.
I would say some of these will cross over a little bit. But according to Wilson law, medical malpractice occurs when a doctor or healthcare worker deviates from the established standard of care and fails to provide the kind of care that a prudent healthcare provider would offer in a similar situation.
Okay.
So some of these might include misdiagnosis, where they miss signs that they should have indicated the proper diagnosis. If you come in with something that could be a bunch of different things, that's one thing. But if you come in with a fairly clear complaint and they misdiagnose it, that's when you might have a case.
Okay.
Delayed diagnosis, where the symptoms indicate that they should run certain tests and they don't do that, that's your problem. Failure to treat, where they find the correct diagnosis but treat you improperly or don't treat you at all. Surgical errors, and this is different than a botched surgery. Well, it is a botched surgery. It's different than an unsuccessful surgery.
Right. Yeah. Okay. That makes sense.
So,
right.
According to this, only if the surgeon failed to adhere to the standard of care does the patient have a basis for a medical malpractice claim.
Right.
So they do things by the book. If it goes wrong because, your anatomy's weird or whatever, or there's an error, that's one thing. But if they're not following the protocol and you have a problem with it, and then birth injuries are another big one. in order to establish a medical malpractice claim, there are a few things that you have to be able to prove. That there was a doctor-patient relationship.
Okay.
So just checking into a hospital will provide you a doctor-patient relationship. If you go to the ER and check in, there you go.
Okay.
That's it. That means like if a doctor is on an airplane and somebody has a medical emergency and they don't step up,
Okay.
they can't. That's not medical malpractice.
Right.
Negligence, they have to have done something wrong that they should have been able to do properly.
Okay.
Causation, so the negligence has to have caused whatever injury you've gotten. So, they hang, not that they would have bags of cyanide hanging around, but if they hung a bag of cyanide instead of a bag of saline,
That would be malpractice.
there you go.
Yeah.
And then it has to have caused you a loss in some way, higher medical bills or loss of income, something like that. So the evidence you need is if you're going to prove your loss of income or the higher medical bills, you could have pay stubs or bills, things like that. In some places, they'll also require testimony of another medical professional saying that it should have been done differently. So you need to have somebody else and another expert weigh in. But the statute of limitations in the United States is 3 years.
Okay.
So if you're going to try and take somebody to task, it must happen relatively quickly.
Okay.
In this case, Christina was causing the problems.
Yeah, I don't know if that's malpractice or just plain old homicide.
So that it is medical malpractice, but it's also criminal.
Okay, so it can be both.
It can be both. So most medical malpractice is civil.
Okay.
Sometimes it is criminal. So when does it become criminal? Manslaughter, which is the unlawful killing of a person without malice, could be medical malpractice and criminal.
Okay.
So, for example, Dr. Conrad Murray was convicted of involuntary manslaughter in 2011, according to Ankin law, because he administered a lethal dose of sleeping medication to Michael Jackson.
Right. Okay.
So that was a criminal and medical malpractice situation.
But it was manslaughter.
It was manslaughter.
Not
he
necessarily.
didn't,
Yeah.
Right. He didn't mean to overdose him on sleeping medication, but he did.
But he did.
Yeah.
Okay.
It could also be criminal malpractice, could also be the result of insurance fraud.
Ooh.
So where they do unnecessary procedures. The most common one is heart stents.
Ooh.
You go in because you need a heart stent and they place more than is medically necessary because they can get insurance to pay for it.
And what's so annoying is there's so many things they won't do.
Right.
Because of insurance that they ought to do. You know what I mean?
Yeah, it's messed up in the U.S.
It's medical care is messed up in the U.S.
It is not perfect in Denmark, as we see, and we're going to talk about a little more. But messed up in the U.S.
Yeah, it's terrible.
So basically, if you have a problem, you need to contact an attorney. Find a good attorney who will talk to you, give you a free consultation, and make a decision. Now, they will help you figure out your next course of action. So they're not mutually exclusive, criminal and civil cases. In this,
could be both.
It could be both. If they lose a criminal case, you're more likely to have your civil case go your way, but they are not mutually exclusive. Just because someone's not found criminally liable doesn't mean that they aren't civilly liable, and vice versa. So you have to prove, according to Berenstein injury law, that they were extremely egregious in their conduct. It is a challenging burden to prove these things. You should take it to them and they're going to help you determine, do you have a case? And do you also need to contact authorities? Okay. So if you do need to contact authorities, if you go to your attorney and they say, this looks criminal to me as well as civil. What you need to do is you need to file a complaint with the police department. Okay. You need to give them as much information as you can so that they can include that in their report. They're going to do some investigation of their own. If they find that there is something nefarious going on, they're going to talk to your state attorney or your district attorney, and then they will determine whether they're going to file charges against this doctor.
Okay.
Or medical professional, not necessarily a doctor.
Right.
Could be a nurse.
It could be a nurse.
Like what we're talking about in the nurse. All right, we're going to take a real quick break, and we will be right back with Is It True, Psychology Break, and Real Life after these messages.
So here's how it works. Christy wrecks her search history. Hey, an essay. We promise it's nothing more nefarious than a podcast. To find out what's true, some of the psychological motivations behind the characters' actions, and real-life applications that relate to our topic. I have no idea what Christy decided to look up. Could be the same thing that captured my curiosity or something I never thought of.
All right. Is it true? So, Pernilla, on her first day of work, goes and changes, and she walks into work in one set of clothes, goes and changes so that they're clean and fresh and relatively sterile. And she has a little medallion that her ID is hanging from.
Oh, okay.
And it is the real symbol for the Danish Nurses Organization.
Oh, it is real.
Yes, it was real.
That's cool.
It was founded in 1899. It has a membership of about 75,000 nurses, 84% of those practicing in the Danish system. And it's basically a union.
That's cool that they use a real thing.
Yeah. Well, I mean, this is all a real story.
Yeah, it is.
Very...
But so often they fake that.
Right.
You know what
that
I mean?
Kind of stuff, like the organizations and stuff like that.
Yeah, they fake that kind of stuff.
Yeah. No, this one's real.
Cool.
Yeah. So, in the hospital, Pernilla's getting her tour the first day, and they go to the medicines room.
Okay.
Now, the doctors aren't allowed in the medicines room. It's only nurses who are allowed to go in there.
Okay.
They have no sign-out system.
Now, remind me what year this is?
2015.
Oh.
Like, super recent.
Okay.
Yeah.
Okay, so it's just like a medicine room, not like a locked...
It is locked. They need their badge to get in, but the doctors are not allowed in there. Only the nurses are. It's a room with medicine in it. They have no procedure to sign out what medications they're using. Somebody just goes in and does an inventory to see what they need every so often.
So it's not locked behind... Wow.
It's like...
I mean, it's locked, but it's not... I guess I'm thinking of the more automated systems where you have to input the patient and the dose.
Right.
Before so it's a 2-lock system.
Right.
In the US, it's a 2-lock system everywhere. There has to be double locks. So the automated system with the cabinets, you see the first lock is putting in the patient with the prescription and whatever. Right. Then there's an actual lock to open it.
Yes. And Pernilla specifically asks about that. She specifically asks, where do I mark down what medications I've taken and for whom? And she goes, oh, we don't do that. We tried to do it once, but it's so busy here that it really just slows us down and causes more trouble than it's worth. So we don't do that anymore.
Oh, that's not okay.
That's what I thought. But, also they're not billing to insurance because they have a socialized medical system there. So it was less of a worry for them. They were just like, the nurses need to go in and get what they need to get. They don't need to worry about marking it down. I agree. I know. You need to know what everybody got.
Yeah, because that's not actually in this one random case. That's not the reason for the double lock system.
Right.
Like that's checklists. All right. So I'm a total nerd. Have you ever heard of Atul Gawande?
Oh,
Okay, I love him.
Yeah.
Oh, God, I've read all his books. He needs to write more. Like, where is he? What is he doing? Like, I'm lost without him.
He's being a doctor somewhere.
I mean, he's amazing. But his first book, Checklists, right? That was, like, life-changing. And reading it, because it was so cool. But yeah, like, this is part of the checklist. Like, this is a part of, like, the double check to make sure the right person gets the right drugs and the blah, blah, blahs.
Yes, exactly. So I was like, is that really true? Really, surely this has to be the thing that's exaggerated.
Right, yeah,
in
like
the show.
fictionalized.
Like, basically, there's nothing fictionalized in this. Hardly anything.
This is true?
It's very, very close to what actually
So
happened.
so wait. Does that mean like it's still like that?
We'll get there.
Oh.
We'll get there later. So they don't have a strict policy of monitoring medications in Denmark, according to Collider. They don't have these records of what's being taken and when and by whom, what nurse is it, what patient is it for, stuff like that. That's how they caught Charles Cullen of The Good Nurse, which is another Netflix movie, which was excellent, but it doesn't fit our criteria because there were patients who were not on board with this. But the Danish system, where they don't mark these things down, they're not as careful about that kind of particular record keeping, makes it harder to find these unscrupulous nurses.
Interesting. Wow.
On this shift, Pernilla performs CPR on a real person for the first time. She's just graduated from nursing school. This is her first real job. She has only done it on a mannequin, a training mannequin.
Yeah.
And so Christina is patient with her. She's a good nurse.
Yeah.
She's a competent nurse.
Oh,
She's
there
not
you
a
go.
good nurse.
Yeah.
Let's say that. She's a bad nurse.
Yeah. But she's competent.
But she's competent.
She knows what she's doing.
Right. And so she's very patient. She's like, you're going to learn.
Yeah.
Here we are. This is what you do. And she teaches her to sing a song in order to get the
Staying
correct
Alive.
beat. Nope, that's not the one she uses.
Another one bites the dust. Because that's the other second favorite.
Nope, it's Gloria Gaynor's I Will Survive.
I Will Survive. That is another one.
So they sing the song, and it's a kind of a running theme throughout all the episodes. It's very fun. There's only 4 episodes.
It's the beats
fun.
per minute per
Yes.
song. Because I actually certified CPR trained.
Okay,
so
yes.
but the
it's
dark humor people like the another one bites the dust.
Right.
But it's a similar beats per minute as I Will Survive
Yes.
and Staying Alive.
Yeah, a lot of pop songs
Yeah.
have this 100 to 120 beats per minute, which is about where you want to be for CPR. Other songs include ABBA's Dancing Queen,
Oh, yeah.
Beyonce and Jay-Z's Crazy in Love,
Oh, yeah, that's a good one.
Stevie Wonder's Superstition.
That feels a little slow to me. Maybe
Yeah,
I'm
maybe.
doing but no, it is.
But-
I think I'd fall in too much of a groove.
Yeah,
I need
yeah.
the pounding like,
Yeah. Yes.
boom, boom, boom.
Uh-huh.
Another one bites the dust. I'm just kidding.
Yes.
No, that's the whole point.
Yeah, exactly. We're trying to. Well. So in that same scene, Christina instructs Pernilla to continue to perform CPR even if the ribs break. Gruesomely and horrifyingly true.
It is.
Yes.
It's less common than you think. Like in my training, it's less common than you think if you're doing it right. But it does happen. And if it does happen, brain needs still oxygen.
Yes. And that's basically what a pro CPR training organization says is basically, you keep going if it happens. If you hear a bone break, you keep going. It happens about 30% of the time.
Right.
It depends on a lot of different factors. So, for example, morbidly obese patients tend not to break a rib.
It's harder to.
Yes. You can still move the things you need to move, but they're less likely to break a rib.
Right.
Older people anybody with osteoporosis, more likely to break a rib.
Right.
It is not great. And CPR is not particularly effective, but we're not going to talk that much about this.
We wish it was a silver bullet,
Right.
but it's not. It's still a miracle,
Right.
but it's not a silver bullet.
Yeah.
But,
I mean, everybody who receives CPR, almost everybody that you see on television who receives CPR, they live.
Right.
And that's just not.
That's not so much the case.
No.
Because sometimes you're doing CPR, but you actually don't know what the cause is at the moment.
Right.
So your CPR could be a moot point from the beginning, but you don't know yet, so you do it.
Right.
Right? Or you're doing CPR, they don't even need it.
Right.
Because they're already gone.
Right.
Or they don't need it because that's not what was going to revive them to begin with, and they're fine,
Yeah.
It's...
There's a whole lot of
extenuating
circumstances, but it's a relatively easy to learn procedure to possibly help somebody.
Yeah.
So a lot of people learn
if that's what they need,
yeah,
there's nothing else to substitute.
Right.
So like if you don't know,
after a really tough night shift, Christina reassures Pernilla that the hospital has a bad reputation, but it's not because the hospital isn't good. The Nukbing Felster Hospital doesn't have a great reputation, but it's not because they're incompetent, is because community that they serve has a lot of comorbidities. This is true.
okay.
So,
All right.
in fact, the Nukbing Falster Hospital administration was looking for assistance from the community and organizations that might be able to help them improve things. They put out in 2021 a call for, if you think you have good ideas, please come to us.
Wow.
But they confirmed in this call for RFP, basically, request for proposal thing, that about 60% of the population that they serve, that 60% being about 450,000 people, suffer from at least one long-term illness.
Interesting.
And 35% of their population suffer from 2 or more long-term illnesses. And this is because in the area, there's a lot of elderly people. There's a lot of long-term unemployment. There is lower education levels. And people tend to have weak social networks.
Oh, that's very sad.
It is sad, but that contributes to a poor reputation for this hospital that is undeserved because a lot of them do have comorbidities.
Right. Wow. Jeez. Which made it a perfect ground for this person.
Yes. Yes.
Not lost on me.
Yeah. All of the sources that we use to inform our discussion here on Killer Fun Podcast can be found on our social media. Join us on Facebook at Killer Fun Podcast, exploring the intersection of crime and entertainment. You can find us on Twitter at Killer Fun Pod, or you can send us an email at killerfunpodcast@gmail.com, and I'd be happy to share a link to whatever information you're looking for. We love to hear from you. You might learn a little something too. Psychology break.
Okay.
So Christina's first victim, both in the show and as far as we know in reality, was Arne Herskov. We see him just before he goes into the hospital. We see him collapse, and then he's found by his brother and taken to the hospital.
Okay.
But when he gets home, he talks to his little dog. Like his little dog is a person. So I wondered, why do we do that?
That's great.
So The Atlantic has an article about this, and they talked to Hal Herzog, who is an anthrozoologist and professor of psychology at Western Carolina University. And he said, talking to our pets is absolutely natural. Human beings are natural anthropomorphizers, meaning we naturally tend to ascribe all kinds of thoughts and meanings to other things in our lives. And humans will do this to just about anything.
Yeah.
I mean, that poor paperclip has been sitting in my drawer forever, not holding paper. It must be sad to not be living up to its potential. These are the kinds of things that humans will do. But we'll do it even more for things that seem sentient, like pets. Or even AI will do it. But we call our pets part of our family.
Yeah, we do.
And this is an anthropomorphization of that's hard to say.
That's hard to say. What is it?
Anthropomorphization.
Wow.
Boy, it's hard. Anyway, we make them like people. We believe that there is a mind in there that can understand
What's
it.
the difference between that and personification?
I don't know. That's an interesting question.
That's easier to say.
I don't know. It is. But people talk to their pets.
Yeah, I do.
All the time.
Oh,
I do.
yes.
Usually we talk in simple, short, grammatically correct sentences to them. We do tend to do it in a higher voice. Check, check. People don't ask open-ended questions as much, though I ask my dog questions all the time.
I'm one for two here because, or 1 for 3 here. Yeah, no, because I don't know that I speak.
Did you have a good day? Did you guard the house while we were gone? Were you a good girl? These are all the things that I talk to them.
Maybe the higher voice, but I don't think I use the grammar. I think I tend towards
like baby talk,
some slang.
No, okay,
maybe, or I revert to some heavy Southern accent. Maybe,
okay,
maybe not. Maybe. What was the last one again? I don't do that either. Oh, open-ended questions? I ask open-ended questions
all the time. I do, and most people don't do that.
But I might answer it too.
If you just provide them the answer often enough, maybe they'll start giving it to you.
Maybe so. Really, I just like the look, the cock of the head for the dog, the little cocked head. Because when I'm doing all of this monologue by myself, it's like this entertainment, and they're so confused, and I think it's so cute.
Mm-hmm. Yes, it's adorable. It is, and I love that my dog has learned that from your dog.
Yes, now all three of the dogs all cock their head the same way, and it's like always
to the right. Yep,
that's so funny.
It is very funny. People who don't have good social networks but do have pets tend to do this more.
Oh, yes.
So if you're a person who lives alone, like Arne did in the show, you tend to talk to your pets a little more. Also, people who are in uncertain circumstances, the I just said it in my brain. The personification allows them to kind of predict their responses a little better. And when you have little control over your life, the predictability of how you think that your dog would be responding is comforting.
Yeah, that makes sense.
So they also put dogs into an MRI machine, but they were very clear to indicate that dogs who went willingly into the MRI machine and laid still.
Okay.
They would play words from their trainers.
Oh, cute.
To see where it lit up in their brain. It's the same general area as in humans. So it doesn't mean that they understand language.
No.
But it means that they recognize it.
Right. That makes sense because that makes sense. I'm thinking about other languages. Like Spanish is the most predominant language in our town.
Right.
Right? And I'm not good at it.
No, me either.
But I recognize it very, very well. I almost really kind of understand it, but almost the same way that you could give me instructions in Spanish, I could probably figure out what's happening, but I cannot converse.
Right.
I do not understand the way that I wish I did.
Right.
You know, without my app.
Right. All right. So when we first see the hospital, there's these like creepy flickering lights.
Ew.
Yeah.
Ew.
Which I was like, that's kind of cheesy. But I was also like, but wait, it's in every horror movie. Why is it scary?
Oh, that's so big. Yes.
Yes.
Why?
So it can be a phenomenon called flicker vertigo.
Okay.
So it'll cause things like disorientation, vertigo, nausea-inducing, and a lot of people feel this with a strobe light.
Oh, yeah.
Okay.
Yeah.
Here's why. So those lights will flicker or flash somewhere between 1 hertz and 20 hertz, which is approximately the frequency of human brain waves.
Oh.
It causes an imbalance in our brain cell activity.
So this is why it's especially sensitive to those who have epilepsy.
Right.
Or at least certain types of epilepsy.
Yes. Yes, because it kind of mimics your brain waves and confuses your brain.
This makes so much sense. Because I can't talk. I literally I had moved a booth in a restaurant in the recent recent past, where there was a light that was flickering, and I wanted to like stab someone.
Yeah.
I had to move.
Right.
But like growing up, one of my close friends has epilepsy growing up, right? She still hasn't. I think she's doing better now with certain medications. I'm saying that. But anyways, in childhood, severe epilepsy. And, as children do, we were kind of like unofficially put in charge of her whenever we went out.
Okay. Right.
Keep her safe.
Yeah.
Right. Keep her safe.
Yeah.
So, we took that seriously, like keep her safe. And so we would see the strobe light long before she would. And we'd be like, no, like get her out of here. And we became very sensitive. I don't deal well with the flashy light situations.
Yeah.
I can deal with some, but not others.
Right.
If it hits, but I conditioned myself to hate it.
That's interesting.
I don't think it actually messes anything up, but I conditioned myself. But it would absolutely send her into epilepsy if we didn't know it was coming or we missed it somehow.
Yeah.
Ooh, Lord.
Oh, yeah. Not great.
Yeah, for sure.
Yeah.
For sure.
It's also, there's another idea about why this happens, about why it's scary. And it's because the flashing, the very bright, then very dark, doesn't give our eyes time to adjust.
Oh, yeah.
And so it makes us feel vulnerable.
Mm-hmm.
So, like, that's why they put them in haunted houses and things.
Right.
You have a feeling of vulnerability because you can't see what's coming.
Yeah, because, like, the next time it flashes,
Yeah.
who knows?
Yeah, who knows what's going to be standing in front of your face.
Yeah,
Right.
that makes sense.
So after she was apprehended, Christina was diagnosed with histrionic personality disorder. So it's a mental health condition, according to the Cleveland Clinic, marked by unstable emotions, distorted self-image, an overwhelming desire to be noticed. People with histrionic personality disorder tend to behave dramatically to get attention. So this is what Christina was doing. She was giving medication that would stop patients' hearts and then, quote unquote, saving them.
Right. Like,
and she's part of the dream team. She, she's always right there when they need help, and she can bring them back. And, sometimes people die.
Yeah.
A lot of people died. Well, I mean, she's convicted ish. It's a whole thing. I'm not gonna go into it. There's lots you can read.
Okay. All right.
But 3 deaths and 1 near death.
Okay.
That there were dozens of cases
where they couldn't
where the heart would stop unexpectedly and not have a particular reason why they could pin down.
Yeah, that's like, what?
Yeah.
But yeah,
So,
that's what do they call it in like the fictionalized, like the procedurals, hero homicide or whatever.
Yeah,
like
that's what this is.
This is it. Yeah.
Yeah.
And I mean, this is personality disorders are so hard because it's just it's not a condition or a disease the same way some others are.
Right.
It's nigh untreatable.
Right.
I mean, near. Just not completely.
They talk about it here, but the problem is that it keeps getting progressively worse.
Yeah.
And particularly with histrionic personality disorder, they don't understand that their actions are wrong in many cases. And they don't seek treatment. They don't think that there's anything wrong with them.
That's the problem with the personality disorder.
Right.
Is that they don't see anything wrong.
Right.
And so it's hard. And if you've ever known anybody who has like a touch of this, that's on this continuum of certain
and that's
traits.
Another part of it is that there's a continuum of it all.
Yeah, there's a continuum. If you've ever met it, it's like they're causing their very problems, but that is actually part of the reward center. Instead
yes.
of the, I need to learn to better. Instead
Right,
of that,
exactly.
Instead of what did I do wrong? Let me not do that again. It's like,
ooh, I'm going to do that again
Yeah.
because I like the results of it.
but they don't consciously think it either.
No,
That's
they
why
don't.
it's a personality disorder, because if they consciously thought it, we might be able to diagnose and treat that.
Right.
But, and it's so sad because I've known people with personality disorders who are actually, their true identity is a kind-hearted, beautiful person. Mm-hmm. And that their brain, their mind, their ways of thinking are so destructive.
Yeah.
That it's hard to overcome it.
Yeah.
But it's not complete. People say it's uncurable, and I'm not in that camp.
Yeah. Yeah.
I'm a little on the.
I would say difficult.
Yeah.
Yeah. And unfortunately, many times you have to get to a very severe situation before you can even start treating it, because it's got to be enough for somebody to require to get treatment.
Because they've learned to function in their dysfunction.
Right.
So it's hard to convince them that anything's wrong.
Yeah.
Right. But also it's, I don't know. It's maybe don't let perfection be the stumbling block of progress.
Yeah. There you go.
With it too.
There you go. Yeah.
Maybe not curable, but maybe things can get better. Mm-hmm. I don't know. It's terrible.
Histrionic personality disorder does seem to occur more in people assigned female at birth, though Cleveland Clinic points out, which I appreciate, that it's probably underdiagnosed in people assigned male at birth.
Well, yeah. Yeah, I agree completely with that.
It's called histrionic.
Thank you. The etymology of the word itself is a big problem.
Really, I can't even use the word hysterical to describe something as funny or talk about somebody behaving erratically or having a strong reaction to something as hysterical, because I hate that word so much.
That I can't do. I can't use it as it's supposed to be intended,
right.
Where it's actually describing an unreasonable response, but I can use it for funny.
Oh, okay.
And I don't know, it's sort of taking the power back, man.
Oh, okay.
I don't know.
I would rather just say hilarious.
Yeah, hilarious works just as
because
fine.
I don't want to have.
Yeah, no, that makes sense. I'll probably think about that next time I use it.
So some of the attributes that they may display that relate to Christina. They have a larger than life presence, the dream team, the doctor, the nurse who's lead or rising in the ranks. She's persistently charming, very flirtatious, inappropriately sexual with people. We see that she's in a club at one point and she does go home with somebody. Not that that's necessarily inappropriate, but it seemed a little inappropriate.
In this case, the way they
the way it was presented.
Yeah, okay.
They have difficulty maintaining relationships. They may seem fake or shallow in their interactions with other people. They need instant gratification and become bored or frustrated very easily. This is why she's giving heart-stopping medications to patients. She's bored. There are better ways to treat boredoms. Have you met puzzles?
There's an app for that.
And they're constantly seeking reassurance or approval. So it could be genetic. It does tend to seem to run in families. It could come from childhood trauma. It could come from parenting styles, which I hate to say, but if it's genetic, then they may have poor parenting styles that then contribute as a risk factor in addition to it. So children who have a lack of boundaries and a kind of a lack of supervision, or it's really inconsistent or overindulgent, have a risk factor for this. And they can't be prevented and there's no cure.
Yay!
Real life.
Real life.
All right. So Christina,
Okay.
the real serial killer, not alone in being a homicidal nurse. It is rare, as I said before.
Yeah, you did. You mentioned that. It's rare.
But serial killer nurses tend to be prolific and difficult to catch.
Interesting.
They know what they're doing.
Right.
They have a lot of access.
Yeah. And there's a natural cover story.
Right, exactly. So Ranker has a list of some serial killer nurses.
Oh my gosh.
We're going to talk about a few. So this guy, Niels Hogel, was a German nurse, and he was jailed in 2015 for 2 murders and several attempted murders. They occurred between 1999 and 2005, but he had a similar modus operandi. He would inject his patients with a cardiovascular drug to create a medical emergency and then resuscitate them. So they believe he had as many as 97
What?
victims over the years, but it's hard to go back and find these things. There's a lot of suspicious deaths whenever he was working. The years he worked at the hospital and the shifts that he worked at the hospital had a much higher rate of death than others. But they only had to convict him of 2 to be able to
put him away.
Put him away. This one, I can't even believe this. Arnfinn Nesset may have killed as many as 138 patients in Norway. And he was caught and convicted, went to jail, and was released.
Why?
Because they have a less punitive system. I don't know why 138 deaths wouldn't encourage them to be more. But because he had fulfilled his sentence, he was given a new identity and now lives in Norway. Now, he went to jail in 1982, so he is an elderly man if he's still alive. But we would know if he's still alive because he's living under an assumed name.
Okay. Okay.
Yeah. We've talked about one before, Janine Jones.
Yes.
She was a nurse and she worked with infants and children.
Yeah.
And her death count is believed to be about 60. Just horrific.
So awful.
This guy, Orville Lynn Majors, he took the lives of about 130 patients, they believe, in Clinton, Indiana, between 1993 and 1995. He had a 360-year sentence, so he's never getting out of jail. But about 33% of all patients admitted to the hospital during the time period and his shifts died.
That's
astounding.
That's huge.
Would you like to know how he picked his victims?
Oh gosh.
The ones who are whiny and demanding.
Oh my goodness.
I know. Like awful.
Maybe they were whining and demanding because you weren't doing your job.
Maybe they were whining and demanding because they were in pain.
Or in pain.
There's something wrong with them.
Or like, just don't be a nurse.
Don't be a nurse. Just don't be a nurse. If you can't handle a little whining once in a while.
I mean, seriously. And I know it's not, I know I know they're surrounded, but also it's like when you go into certain professions and they don't seem to like the main demographic of that profession. And you're like, why are you here?
Teachers who don't like kids.
Yeah. Like teachers who don't like kids.
Yeah.
Administrators who don't like parents.
Yeah.
You know, customer service reps who don't like customers. You know, that kind of thing.
Yeah.
You know?
Find a different job.
Find a different job. It's okay.
And then there was Peter Zelenka, who in 2006 was a nurse in the Czech Republic. He injected at least 17 of his patients with heparin, a blood thinner. And he did it because he wanted to test the doctors to see if they could figure out what was causing the internal bleeding before they died.
That's wow.
Yeah, 7 people died. He injected 17 patients. 7 of them died.
Wow.
That seems poor. And literally within the last month, there was a new case of nurse homicide here in the U.S.
Oh, my God.
May 25th, Pennsylvania nurse was arrested because she was working in a care facility for like generally older people, but sometimes younger people go there to recuperate after certain situations. She gave lethal doses of insulin to 3 different patients. 2 of them were not diabetic.
Oh my God.
2 of them died. 1 did not. But she overdosed.
Why?
I don't even know. Like, that is not, like, she's been arrested. They have the evidence against her. She's not gone to trial yet, so we don't have that information yet.
my
But
gosh.
literally, like, the end of last month.
Wasting insulin.
Ugh. So Pernilla felt anxious before she started her first shift at the hospital. You're starting a new job. Everybody feels a little anxious, but it's also not uncommon for nurses to have some pre and post shift anxiety, even when they've been on the job for.
That doesn't surprise me.
No, me either, because it is a job where it's a very demanding, and it can be a very critical situation.
Yeah.
Nurse Journal has some suggestions, and some of these are helpful if you're in any kind of stressful situation, or going into a stressful situation, or you work in a stressful job. So, exercise, eat right. These things are helpful. They also suggest making sure you have a good community of people outside of work, so you can really disconnect from your job. If you're feeling anxious, get to work a little early, kind of get the lay of the land, kind of know what you're in for. That can help ease your anxiety. Even if it's going to be a stressful shift, it can ease your anxiety if you know what to expect. Take care of yourself while you work. A lot of nurses tend not to drink water or eat. You should do both while you're working. And this is the most interesting one. After your shift, exit with a coworker.
Oh.
Labeling your feelings reduces the neural activation in your amygdala, the area of your brain responsible for the flight or fight response. When you label your emotions and talk about them, it moves your response away from the limbic region, and you become more mindfully aware. So,
That's
debrief.
Good. Debrief.
So if you're in a stressful situation and, we're like, oh, thanks for letting me vent. It's literally a thing that can help calm your anxiety about the situation.
Good stuff. Good advice there.
So on her way to this first shift, Pernilla sees doctors and patients outside the door smoking. We talked about bad habits in this area. Doctors should know better. And yet the National Library of Medicine has a study talking about the prevalence of smoking among physicians. Now, it's a meta-analysis. So it's many studies that they basically combine together to be able to create this overarching study.
Right.
The rate of smoking is decreasing among populations around the world.
Yeah. Okay.
So, but still, some older studies are still in here. So the prevalence may be reducing. But if we're going to extrapolate, which is what this study basically does, we can say, based on population, still, we have a general idea. There were 246 studies and almost 500,000 physicians as part of it.
Okay.
They found that about 21% of physicians smoke.
I don't know why this does not surprise me.
Well, because it's stressful.
It's so stressful.
If you come from, particularly if you come back from a less affluent background, you're a little more likely to smoke because you live in a stressful life and there's more of it around you. So you're more likely to pick it up. Incidentally, practitioners in Europe and Asia have a slightly higher percentage, but again, it's decreasing over time. So some of these studies are a little older. They skew the results a little bit. It could be a little lower than that, but still, it's a higher percentage than the typical citizen.
Like the general population.
The general population.
Yeah. I'm not surprised by this.
Yeah.
Yeah.
I'm not either, but like they should know better.
They should.
But there's all things that we should know better that we do anyway.
Well, and isn't that the case?
Yeah.
Like it's horrible, but like we also rely on a lot of like those general surgeons warnings and the marketing and all of that kind of stuff. And it's not like it's a bad thing. It's a good thing. But they sort of make you think that like everyone who smokes is going to get cancer.
No, it's just a risk factor.
It's like any other risk factor. It's a pretty decently high one.
Right.
We need to pay attention to it.
Right.
And nevertheless,
Right.
the majority of people who smoke don't get lung cancer.
Right.
Which, when you say that to people, it's almost like offensive to hear.
Oh, they get mad about it.
They get mad about it.
But that's not the only complication that can come from smoking.
It's not, but that's the only thing like that's really pushed on the media.
Right.
So
Right.
there's this idea.
Right.
That,
Well,
like,
because cancer is the C word and it's really scary.
Right.
So that's the one they use.
That's the
because
one they use.
Cardiovascular health.
right, COPD.
Yeah, is way less scary to people.
It is, which it ought to be almost more scary, FYI. But like, and it's hard because those stats are still the stats. They aren't just straight up causation. It would be easier if it was, but it's not. But with stress, definitely want them smoking, not drinking.
Mm-hmm. Well, this is true. I mean, this is true because we don't want drunk physicians.
No,
in the
and I
operating
want
room.
a person who's been on a break. So
Yeah, there you go.
just kidding. I'm kidding, but I'm not kidding. Sorry, no, sorry.
All right, so I said I would come back to the whole Denmark documentation.
Oh yeah, the checklist
stuff
thing.
that we would talk about a little more. So in 2019, actually before that, but this is the article in Politico is from 2019.
Okay.
Denmark realized they had an issue
Okay.
and they wanted to do something about it. So they hired a company called Epic who does IT for hospital systems.
Okay.
And they're relatively successful in the US. So Denmark hired them to say, we need something like what happens there to what happens here. So if somebody goes to a doctor in a different part of Denmark, their records can be accessed and we know what kind of medications they're on. And we don't have to rely on the guy who's been out of work for 6 months and has drunk himself into a stupor to be able to remember that he's taking heart medication.
Right. Yeah. Yeah.
All he needs to know is his name and we can figure out,
Yeah.
what's going on. These are the kinds of situations they wanted to solve. Unfortunately, the Danish experience with this particular organization has produced results that go from frustrating to disastrous.
What?
Because it's very difficult to translate. This is where we get to the whole Danish is hard thing.
Yeah. Okay.
Because there wasn't a lot of, there was some translation errors that really made it challenging. So, for example, a C-section in the Danish system that they created was the executive suite.
Oh,
And
like
not an emergency procedure.
The C-suite.
The C-suite. Yeah, exactly. So
What?
then for a while, this situation, this piece of software offered Danish doctors the opportunity to amputate the left leg or the correct leg instead of the right leg. So there was all of that made it really challenging. So you'd think that it would be better. Well, the article goes very in depth. It's very interesting, but it's extremely long.
Okay.
But basically, they said, despite the fact that the U.S. healthcare system stinks, it made it so that this particular part of it, this documentation, worked really well.
Okay.
Because they had to document all of these things to be able to bill insurance.
Right. Yeah. Uh-huh.
You have to know what medications so that you can bill it, what procedures so that you can bill it. So they don't have that there. They have socialized medicine. You'd think it would make it easier, but it actually made it much more difficult, and that the systems were developed to be able to bill more efficiently, and that the care component was more of an afterthought.
Right.
And so what they need is the care component. And so it's been really frustrating.
Oh, interesting.
Yeah.
That is interesting.
Yeah.
Wow.
Yeah.
Lost in translation.
Yep. Doctors tend to be reluctant to stop CPR in emergency situations. So we see this in the show. The doctors who are performing life-saving procedures, typically CPR and the electroshock. They stop and say, we've done it for this long. We've done this many rounds, this many shocks. And does anybody disagree with stopping treatment? They make a verbal confirmation of that. That's part of their procedure.
Right.
And this article from the Washington Post talks about how it's really hard for physicians to stop CPR, even when they know that it's probably not helpful any longer.
Like it's too late.
It's too late because nobody can fault you for keep going.
Yeah, right.
Like if you stop too soon, maybe it could be your fault. Maybe they could have been saved. You didn't do it long enough. But if you they know it's too late. And they keep going because, well, what if, and that it actually can have some complications because you can do things where you're circulating the blood and the body really isn't revivable, but you can revive it a little bit and restart the clock and put the body through a lot of pain, and the patient can maybe even almost seem to start to come around a little bit, but it's just because you're doing the compressions. There's no hope of saving them. This is a very sad situation.
Such a complex thing, right?
It really is. Yeah, it made me feel for them.
Yeah.
I'm not cut out for the medical field. But if you liked this show, which you don't know.
I don't know yet. I mean, it sounds riveting.
I think
now.
I think you will like it.
Yeah, I feel like I like an overdub.
Yeah.
Because, for instance, Cleo, not overdubbed.
No, it wasn't?
It's closed caption or not closed caption, whatever. It's subtitles. That's the best word.
No.
And so it was a little rougher. Yeah.
Because I found a overdubbed. I'm surprised about that because I found an overdubbed trailer.
Oh, maybe.
And I thought it was overdubbed. That's
I
wouldn't have
so
suggested.
too. But it was totally subtitled. So unless there's a different version of it on Netflix,
you might have to make a choice from some options.
Maybe some options. Anyways, but yes, but overdub.
But if you like to hear the stories of homicidal nurses, there's options for you. So there's The Good Nurse, which we talked about that we haven't really done a lot on because there's not a lot of buy-in. But they had not only that about Charles Cullen in New Jersey, New Jersey's most prolific serial killer. They had a documentary about that same guy who came out like 2 weeks after The Good Nurse called Capturing the Killer Nurse. So then we have The Nurse. And then there's one called Ratchet.
Oh, ha!
Which is a prequel to One Flew Over the Cuckoo's Nest.
I think I meant to watch this at some point. I never did.
I did too. It came out in 2020.
Yeah, I definitely meant to watch this.
So, but yeah, and she's, similar.
Right.
So if you watch The Nurse and like it and want to like it, it's a weird way to like something. I know. We've talked about
We like the show.
Right.
We like the show.
Right. We found the show interesting.
Yes.
There's options for you.
There's options.
All right. Next time.
Let's see if Jackie gets it right next time.
You will. You will, because you've already watched this show because you're the one who suggested it to me. Another Netflix show. It's a delightful comedy, Unstable. Yes. Stars Rob Lowe and his real life son, John Owen Lowe, as grieving family members. And there's lots of psychology, and there's just enough crimey behavior with some light kidnapping to make it an option for us.
There's a smidge of crime throughout the whole series.
Sure.
It's probably the least crimey thing we cover, but we can't skip it. It's just so fun.
No, it is fun. And we'll probably, they're half-hour episodes, I think. So we'll probably watch 2.
Yeah, let's do 2.
Yeah.
Definitely.
So, awesome. All right. Thanks so much for listening. Be sure to rate and review wherever you get podcasts. Tell a friend. It's way more fun when you can listen with a friend. And until next time, be safe, be kind, and wash your hands.
Da, da, da.